Chemistry, how the interactions of chemicals in water create the human genome recipe for life.
Chemistry is in our daily lives in one way, shape, or form. It is used to create everything from the cleaning products we used to the vitamins we take every day, and it even helps to keep our drinking water safe to consume. Having safe drinking water is something that should be of high priority. It is of such high importance that in September of 2000, when the United Nations Millennium Summit met, it included water sanitation as one of the Millennium Development Goals. This target goal states, have, by 2015, the proportion of people without sustainable access to safe drinking water and basic sanitation. This statement alone shows a link between water sanitation and our health. The reason why safe drinking water is so important is because contaminated water can have very negative impacts on our health. These negative effects range from affecting our neurological function to causing medical problems for our infants, such as blue baby syndrome. Methemoglobinemia, also known as blue baby syndrome, can be caused by one of three major factors. It can either be caused on a hereditary level, be drug or chemically induced, or be diet induced. Since we cannot necessarily change someone's genetic makeup, we should do our best to help prevent harm by factors that we can control. Nitrites and nitrates can both contaminate drinking water. If this contaminated drinking water is introduced into a baby's diet, it can cause the baby to develop blue baby syndrome. Although it can be easily treated, it is just as easy to prevent it by keeping our water free of nitrates and nitrites. As you can see, there is a clear link between chemistry and how it affects our health. With that being said, this link between chemistry and health is our genomes. If chemistry such as contaminated water gets introduced into our diet, it can negatively affect our biochemistry. When our genetic makeup has been compromised, this can lead to cell mutation and eventually lead to cancer or other things such as blue baby syndrome in infants. On the flip side, if we introduce good chemistry such as calcium or vitamin D, it will have a positive effect on our genomes, therefore giving us stronger bones or an improved immune system. It is important for us to be aware of the chemistry that surrounds us every day and the impact it has on our genomes, and therefore its impact on our health. By keeping ourselves educated, we can better keep ourselves and those around us in good health.
Chemistry, the building block of life. And it begins with an exome, a piece of life that provides the recipe to create power, speed, and strength. And the building blocks of who and what we are is derived from one single recipe called the human genome. You can think of the human genome as a playbook with a table of contents and index, shaping how our DNA interacts, creating specific genes derived from protein structures and chemical structures, all working cohesively in a well-orchestrated manner. When we look at the human genome, we realize it's large. There's 20,000 genes packed into specific chromosomes. So what scientists do is they look at a slither. They take a piece of that called exome. And through a process, a technology called exome sequencing, we can then look at information about our DNA makeup. Biotech, pharma, and healthcare academic research centers use information derived from the Human Genome Project to help combat specific diseases such as blue baby syndrome. A leading biotech company in California by the name of MicroV is actually trying to combat baby blue syndrome. They're one of the first companies that have developed a number of drug discovery, development, tools, and technology to help mitigate these problems.
Since clean drinking water is a top priority for MicroV, the company has spearheaded the initiative to develop technology to combat blue baby syndrome. In order to fight this illness, MicroV has developed technology that eliminates nitrates from water, making it safe to consume. Nitrates are not only a global problem, but a large problem in California and hits home for the California-based company. It is estimated that 10% of the groundwater in California has nitrate levels of 5 ppm or higher. The desired level of nitrates in drinking water is less than 5 ppm. The MbN2 technology that MicroV has developed has been able to reduce the level of nitrates in drinking water from between 35 to 54 ppm to less than 5 ppm within minutes. MicroV has not only developed this incredible technology, but also has made it environmentally friendly and efficient. This company's micro-niche engineering methods for water treatment offer up to a 10% cost savings and an 80% decrease of the life cycle energy costs when compared to other methods that are available. Companies like MicroV are not only helping with developing greener technologies, but also helping prevent medical costs of preventable illnesses such as blue baby syndrome. The more we are able to use chemistry to our advantage and prevent diseases and illnesses by making our environment greener, the more we will be able to enjoy a healthier life.